In this video, we will be going over generic ambulatory clinic workflow. We will review physician documentation, entering same-day imaging, lab, and medication admin orders, as well as prescribing medications. In this scenario, the patient M2 is being seen in clinic for a thoracentesis consult and procedure. Upon registration, the patient will be instructed to go to the clinic. Once at the clinic, the patient is called into the treatment room and is seen by the nursing staff. They will complete their documentation on the general surgery clinic note. The patient is now ready to be seen by the physician. The physician can review the patient's chart prior to seeing the patient. We will start by opening the WebM clinical home screen. There are two options on how to access the WebM clinical home screen. Option 1 is to change the subdivision. To change the subdivision, click on the subdivision button at the bottom of the screen. Enter the ambulatory facility in the facility field. I will select Collingwood General Hospital, Ambulatory, and click OK. On your main menu, click WebM Home Screen. Option 2 is to navigate to the acute status board. You will automatically be redirected to your sign list if you have outstanding items that require your signature. From here, you can click the Home button on the black navigation bar. Click Leave Now. Click the drop-down arrow next to the Home button. Select Ambulatory Clinical Home. On the clinical home screen, you will see your schedule with your booked appointments for the day. You will search for the patient and click on their name to launch their chart. After reviewing the patient's chart, the physician is ready to see the patient. While seeing the patient in the treatment room, the physician determines that the following orders are required: a chest x-ray, electrolytes, and a lorazepam medication admin order to be performed by the nursing staff. To enter these orders, the physician navigates to the orders routine by clicking on the orders button on the black navigation bar. Once in the orders routine, the physician clicks on the Search Orders Sets field. We will start by searching for the lorazepam medication admin order. You can start typing out the name, and then once it displays on the drop-down list, you select it to add it to your Manage Orders list. We will now search for the lights order. Lastly, we'll search for the chest x-ray order. Please note that all imaging orders are prefixed with RAD. I will select the RAD chest 3+ views order. You can now review the orders that have been entered by clicking on the chevron to the left of the order. Once you have reviewed it and you're happy with your entry and you're ready to sign off on the orders, you can click the Sign button. You're now required to enter your PIN. Once the orders have been submitted, the physician would inform the nursing staff of the medication administration. The nursing staff will document the administration on the Procedures Document section of their document. Once the medication has been administered by the nursing staff, it will be documented as given within the medication widget. The patient will be instructed to go to the lab and imaging department to have lab work and x-ray completed. Once those have been completed, the patient is instructed to return to the clinic to be seen by the physician. The physician is now able to view the patient's results within the patient's chart. To do this, the physician opens the patient's chart by clicking on the patient's name, and and navigates to the Diagnostics folder. Within the Laboratory folder, the physician can view the patient's lab results. And within the Imaging folder, the physician can view the X-ray results. Please note that in the future, an icon will display to the left of the document to indicate that there's the image available to be viewed. The physician can view the image from the patient's chart or may choose to use the PAC system to view the X-ray image. Following the review of the results with the patient, the physician reviews the risks and benefits and obtains consent to perform the thoracentesis. Following the procedure, the physician determines that a follow-up chest X-ray is required, along with cell count, body fluid, and a Tylenol 3 prescription for pain. To do this, the physician navigates to the orders routine by clicking on the orders button on the black navigation bar. We will start by entering the X-ray and lab orders. So first we'll enter the chest X-ray. We will select the chest 3+ views. And now I will search for the cell count body fluid order. Okay, they both have been selected, and I can hit save. Again, we can review the information for each order by clicking on the chevrons. All right, we can view the order information. And now we will sign off on the orders by clicking the sign button. Once again, we will enter our PIN. Okay, the orders have been entered. We will now review how the physician enters a prescription for the pain medication. To complete a requisition, the physician clicks on the Medications button. We will start with searching for the medication. All right, we will select the first one here, and we'll prescribe 30 tablets. We can click on Queue and Exit. We now have to sign off on that requisition, so we click the Sign button, review the information, click Sign, enter our PIN, and now we can print that requisition. I'm going to hit Apply. And you select the appropriate printer. We'll hit Apply. Once the requisition prints, the physician would sign it and provide it to the patient. The patient would now return to the imaging department to get the X-ray completed and the lab department to have lab work done. Following the X-ray, the patient would be instructed to once again return to the clinic. The physician would review the X-ray and is now ready to discharge the patient. Once the patient has departed and the physician is ready to complete the visit documentation, The physician would navigate to the documentation routine by clicking the Document button on the black navigation bar. From the documentation routine, the physician selects the appropriate clinic document. I will search for general surgery, clinic, and we want to select the report. So report is for physicians, and the note is for nursing and allied health staff. So we will select the general surgery clinic report. The physician will now click on the reason for consult and will use DMO to dictate the note. I will now use DMO to provide a sample of a dictated report. The patient was seen in clinic today for a thoracentesis consult, period. An X-ray was taken and reviewed, period. The patient was assessed and it was determined that a thoracentesis would benefit the patient, period. Consent was obtained prior to the procedure, period. Indications, commas, risks, comma, and benefits were explained at length, period. The patient's left side was prepared and draped in a sterile manner after the appropriate infiltration level was confirmed by ultrasound, period. 1% lidocaine was used to freeze the surrounding skin, period. A finder needle was then used to locate fluid and clear yellow fluid was obtained, period. The thoracentesis catheter was then threaded without difficulty, period. The patient had 100 ml of clear yellow fluid which was removed, period. The catheter was removed without difficulty and a dressing was applied, period. A post-procedure chest x-ray was ordered and the fluid will be sent for cell count, period. Patient was prescribed Tylenol 3, 30 tabs for pain, period. The patient was stable and discharged, period. The physician may choose to capture a problem by clicking the Add button on the problem field. The Problems and History List overlay will open, and the physician may search for the problem. Additionally, the physician may choose to enter the billing code on the report. Please note, this does not display on the output of the report. The physician may print a report with all the billing codes at a later time if they choose to use this functionality. Once the physician has completed all documentation and is ready to sign the document, they will click on the Sign button. On the Submit overlay, the physician may choose to add additional physicians to whom they would like the report to go to within the Additional Copies To section. Once the physician is ready to sign, they click the Sign button and they will enter their PIN. The report is now in a signed status and can be viewed in the patient's chart. If you have any questions regarding this demonstration, please contact your expense team. Thank you.